All right, thanks a lot, guys. So I want to thank the team at Nucleate Bio that I was just introduced to a few months ago. I'm really encouraged by your mission and want to participate as much as possible. And thanks for inviting me to give a talk at this venture creation seminar series. As some additional background, when I did my PhD training at Stanford, I specifically chose to work with Gary Nolan, who some of you may know, because of his entrepreneurial nature. And as luck would have it, my thesis actually became a startup company called Rigel almost 20 years ago. And so that's really where I caught the biotech bug, and it's been with me ever since. So, of course, my career has become this has become a passion of mine and a trend. I've been, in the fortunate position to work with great people and to serially, start companies both outside of and within pharma, and now with Versant. And so I'm delighted to talk about how we do that. And I wanted to specifically talk about, beyond how we do that, one of the companies that we started called Lycia, which has come out of our biotech creation engine called Inception here in San Diego. So first, I wanted to give you a brief introduction to Versant. We're now in our 8th fund, and which is approximately a $950 million fund to invest in breakthrough companies across many different spaces. And there's some unique features that distinguish Versant beyond the successes of the companies that we've created. First, Versant has a real dogged focus on creating cutting-edge companies based on innovative technologies across different spaces. So not unlike many others. But second, we have a broad geographic reach. We have offices on the West Coast in the US, in Boston and New York as well. In Canada, we've got 3 sites, and we've got sites in Europe as well. And so that allows us to tap into innovation really every corner of the earth. And third, we have a significant focus on company building and have for over a decade, either based on our network within the VC community looking for syndicated deals. But I think what we're really known for, and that's unique, is our company creation model, either de novo companies based on ideas that we discover and find, or through our discovery engines, where we're able to basically identify earlier nascent science and wrestle with those and determine if those could become the next breakthrough company. And this gives us the ability to test the ideas before we fully finance them, with the goal of translating those visions for companies and into new medicines and create real value. So today I'm going to focus on Inception, our discovery engine based here in San Diego, California, where I am now. Let's see, it's still light out, with a crew of fantastic scientists, company creators, and venture capitalists, all in one building, urgently focused on finding and creating the next breakthrough company. And San Diego is actually the original site of the discovery engine model, which was founded back in 2011, so just over a decade ago, which in its current incarnation develops companies with wet bench scientists focused largely on chemical biology as well as complex biologics, and when the occasion strikes, modalities outside of those. And we're backed exclusively by Versant. So the effort here is led by a team, a well-oiled team, including myself as CEO, and Joe mentioned some of the places that I've been. Richard Glynn, whom I've known for 20 years. We work closely together at GNF. He's our Chief Scientific Officer. And then 2 managing directors at Versant, Tom Vivode and Clara Zawa. And we're all in the same building. And so that makes it really easy to align on what the next great new company concept is. So I really want to put a little bit of time into how it works. How does the Inception model work? At a high level, we like to engage academic entrepreneurs to identify bold new ideas and breakthrough science to champion. We figure that those who have been there and done that are likely to strike again. And so we like to focus on doing companies with folks who have already done one before. Second, once we get excited about an idea, and I'll describe that in more detail, we'll typically put anywhere from $1 to $10 million into that company to validate the science and to begin to further evolve the concepts that we come up with, further develop the relationship with the founders and really get to know them and how to work together. And during that time, as we begin to build a lot more momentum, get excited about the science, momentum is really critical. You cannot lose momentum because there's always the next sexy idea that could take the place of the one that we're working on. And so, but if we continue to be really excited and the business and the science are holding up, we'll begin to license the technology and build out the corporate strategy. And it is a bit Darwinian. Not every concept makes it all the way to the launch phase. And not all of them continue to register with the folks at Versant and Inception. And so that makes sure that any company that we do launch, is something that we're really all excited about. So why do we actually have these discovery engines? What's unique about that? And we do this really because it gives us a massive head start. Having a team of idea hunters coupled with rigorous scientists to validate or invalidate the science gives us the ability to really hit the ground running. And this is with a ready team of scientists who are ready to take the baton from the founder's lab and industrialize the approach with real lab space, which is very hard to come by these days. Also a CEO and a CSO who can develop the company further. And that really is appealing to founders. They like the ability to get, to hit the ground running and begin to develop the idea without having to wait around. It's a competitive arena, as you know, and you've got to be first if you can be. So, so we really enable those companies to ultimately become standalone entities, and that is part of our job, is to launch these companies and equip them with the ability to stand on their own as they develop into the future. So many technologies, in fact, are pretty one-dimensional when you first hear about them. So it's not just like you can plug it into our infrastructure and boom, out comes a company. There's a lot of deep thought that goes into how to industrialize and best leverage and deploy the technology and the team. And target selection is super critical. That is oftentimes, when we find a new technology, the biggest question: what's the killer app? What's the reason for this technology to be? There are a lot of great technologies out there, and many of them are only able to solve the same problems that other technologies that have come before them are able to do. So, so then when we do pick the targets and we do get excited about the company, we begin to look for that C-suite, to ultimately take the baton, and we, hand off the baton. It's like a relay race, and they can hit the ground running as well. And when they do that, that opens up the space. It liberates, our folks, the scientists, as well as executives in the company, to delve into the next great idea. So at any given time, we may be working on 2 or 3 companies at different stages, at the launch phase, at the seed stage, or in that really creative ideate and explore stage. So some examples of the companies that we have built with the discovery engines, and I'll mention Ridgeline is another super prolific discovery engine that's in Basel, Switzerland, run by Alex Mayveg and the team there. But some of the examples that have come out of the Inception Ridgeline model include, Chinook, a precision kidney medicine company, now public, up in Vancouver and Seattle. Also, Ventus, a company that is shared between sites in Boston and Montreal, focus on structural insights in innate immunity. Also, Brightpeak, synthetic protein design company. And last but not least on this list is Lycia, an extracellular protein degradation company that I'm going to tell you about in a short period of time. But I think it's really important, and for this group in particular, to think about, where do we find new company ideas? They don't just land in our laps. We actually have to go find them. I spend half of my time looking for these things and talking to people and talking to serial entrepreneurs. Ultimately, the goal, as for most VCs that are into company creation, you want to create a sustainable pipeline of new ideas and opportunities so you can be Darwinistic and make sure that you're only working on the cream of the crop. And the way you do this, and no one's got it 100% right. This is an art and it takes a lot of work. This is not for the faint of heart. You gotta kiss a lot of frogs before you find those princes. And so key relationships, people those are really important. Just meeting Kevin and Joe right now, I think we're going to start a company one day. So we're going to stay in touch, hopefully with some of the folks that are on this call as well. So we stay in touch with academics and entrepreneurs. And fortunately for myself and my team, we've managed to accumulate a lot of gray hair, but also relationships that bring forth new company opportunities. We are continually mapping what are the hot spaces to get into. What are the waves of innovation for the next set of companies? And that's something that we collaboratively do between Versant, Inception, pharma, KOLs who have crystal ball. It's pretty important to be working with folks like that. And then we also, although there are multiple sources, we are not, geography focused in San Diego. Although some of our ideas do come from folks in San Diego, and many of them come from universities across the country and in Europe and China, Japan as well. So it's a far-reaching network that we've created to unearth and find these opportunities. So that's that's in a nutshell, where we find some of these ideas. But I'll have to say that probably the most important thing that we've done at Inception and Versant is work with serial entrepreneurs who are on top of cutting edge science, in fact, creating some of it themselves. And these are our scientific advisory board members. You'll hear about a story that we developed with Carolyn Bertozzi. She started more than 4 companies in her lifetime. She's the inventor of bioorthogonal chemistry. Maybe she'll win the Nobel Prize there. She's a font of new ideas, and just any discussion you have with her, you come up with 2 or 3 cool new ideas. Ben Cravat, same story here, kind of a growing legend in San Diego. He's put together 4 or 5, maybe 6 companies of his own, involved in many more. We work extremely closely with Ben. He's one of the top chemoproteomics gurus out there. Started Activex, Abide, Vividion, which just got acquired for $2 billion, and we're working on some additional companies with Ben. Nathaniel Gray, who just moved from Dana-Farber to Stanford, joining forces with Carolyn there, is another terrific entrepreneur. He started 4 or 5 companies of his own in the protein degradation space, targeting kinases as well, and was actually a colleague of mine in the early days of GNF with Pete Schultz, beginning to work on drug discovery for the first time. And then, of course, there's Jim Wells, who's a world-renowned protein engineer, one of the first scientists, one of the founding scientists at Genentech, who's just been a delight to work with, also a fountain of new ideas. But not only do these guys have ideas of their own, but their protege, their progeny, if you will, also have great ideas that are largely in similar areas, things that we're also attracted to. And this team puts us in touch with all those folks and is constantly scouting for us in new ideas and people, as well as helping us vet new ideas. And once these new companies are formed, oftentimes form the foundation of an SAB, at least early on in the genesis of those companies. So what do I mean by kind of waves of innovation, and how do we decide which are the areas to get into? I picked a few areas that I think no one's going to argue with me are important and pretty hot today. Precision oncology, artificial intelligence, molecular glue, and there are many others. And the question that we're always asking ourselves is, at what stage is this wave of innovation? Is it a wave that's just forming? Are we too early? Or is it cresting? It's crowded, it's too late. It's going to come crashing down on you if you start a company now. So, the question is, how do we think about this? And we often make, because of our, Canadian brethren, think back to one of the great hockey players, Wayne Gretzky, and ask, if we could try to skate to where, the puck is going to be. And so that's the fundamental question. And there's no right answer. There are a lot of wrong answers, but there's no right answer. So you have to cast your net widely. But at the same time, you do need to focus. So I want to talk about some things that may seem obvious, to a lot of people, but I think that they're really helpful when you're thinking about what types of companies, to put together, and the types of companies that I'm personally interested in and that we like at Inception and Versant. So the first question is, where on the innovation highway are we? Are we too early? Are we too late? The second is there a compelling technology behind this company idea? When you think about risk, and something I learned when I was at Merck, we did an inventory of all of the mechanisms, the novel mechanisms of drugs that we were developing. And greater than 70% of the first-in-class drugs, so against a novel target, failed. They failed in the clinic, and that's very expensive. And so biological risk is an expensive prospect. We're much more excited about validated targets, although they may be less interesting to some. They're very interesting to investors, because once you have a molecule that works against those, you're likely to sail through the clinic with relative ease. Nothing's easy, but it's less time consuming and less expensive if you're working on a target that's well validated, like a PD-L1 or a c-MYC, for instance, but something that hasn't been necessarily drugged before. So we're much more excited about platform technologies where there may be immense amounts of technical risk. Think of CRISPR. No one thought that would be a drug, and now we're in man. So we like platform technologies that have broad applications against clinically validated or genetically validated targets where there's compelling human biology to support going forward. A third question we ask ourselves is differentiation. How differentiated is this approach? Is it a me too? Or do we have an unfair advantage? Is this something that everybody is going to want to get in on? And so that can be in the form of IP. It could be in the form of some know-how. It could just be an approach that no one else has been able to get to work. And the second question along those lines is, does it uniquely solve a problem in the field? We constantly ask ourselves when we hear about a new technology, is this just another way to go after MYC, or is it the way? And so that's really important when we're telling a story about companies, when we do take them out to launch. Another point is the opportunity space. Are there a broad set of opportunities? That often comes with the platform technology, but not always. CRISPR, again, has a broad technical applications. RNAi, any target was in scope. Obviously, it becomes limited as you begin to know more and realize you can only get into the liver, et cetera, and so forth. But there has to be a compelling set of opportunities to really build a company, so much so that it's even difficult to prioritize which ones to go after. Another really critical point is reduction of practice. How ready is the technology for financing? Is this something that an academic just thought of? or have they reduced it to practice in their lab? Have others gotten it to work in some way, shape, or form? So, how viable is the approach? You want to make sure that you're not investing too early. But of course, inception, we're able to invest a little bit earlier at low cost to de-risk ideas. And for those, that are de-risked and validated, those can really take off. Another important element that we think about is star power. And that comes back to the network and who we're working with. And over time, I expect everybody on this call to have that, star power. I know it's in you. And then it just comes with, getting that first opportunity and building up a track record. We do like to work with people who have had success in the past. It's usually the best predictor of future success, but it's certainly not, the only predictor. And then the other thing we always think about is dual liquidity. And Versant is really well known, I think, for M&A. And more recently, for IPOs. And so for every company that we want to put together, we need to ensure that both are possible. Sure, anything could go IPO, of course, right? If the time is right and the finances are there, the market's right, but not everything could be acquired. And so this is why we keep a very close eye on pharma and what pharma's interested in. So we're unlikely to start a company in a space that no pharma is interested in. It just limits one potential arm of future liquidity. And so I'm going to spend a couple of minutes, not dwell too deeply on the next few slides, but when we think about this first area, like precision oncology, where do you want to be? Again, going back to the waves, what has crested and what is maybe too early. As a firm, we are focused only on therapeutics, and so we don't do diagnostics. So those are out. Plus, there's a reason behind that. Largely, it's a tough business. The margins are small. There are companies who have been successful. It's not our specialty really any longer. So that narrows it down to true precision oncology, where you're targeting a specific oncogenic driver that's identifiable by a mutation that drives oncogenesis. What's great about that is there's low biological risk, and there are companies in that space. Now, I think it's really challenging to find new precision oncology targets because I think, they're all pretty much out there and published. There will be new ones. You need to work with, academics who have access to massive, sequencing databases to find a new one. You might be better off, partnering with pharma to identify those. But that's a hot area, and there's still opportunity there, I'm sure. The other area is in, what I call, quote unquote, precision oncology. This is where you're targeting an oncogenic driver that's identified by overexpression or some linkage to cancer, tumor suppression, or it's because you're precisely delivering a payload to a specific, target cancer type through, an antibody drug conjugate or something along those lines. This is also a hot area. There are many, many competitors in this space. And so it's going to be very hard to find, great new ideas in precision oncology, but it's worth it because when you find these, you can define the clinical patient population and where you're aiming. The next area that's gotten super hot over the past few years, and I'll use the word hot and compelling interchangeably, but is artificial intelligence in drug discovery. And I think there's been some really terrific companies in this space. Many of them started off in screening, Atomwise more recently, but Schrodinger has been around for a long, long time. And they've done a great job at being able to screen and identify new compounds, starting points against traditionally challenging targets. What could possibly be new in that space? Well, we've got our eyes open if anything does pop up in that area. And we always ask, is there still meat on that bone? On the far right-hand side are target identification AI approaches, used by Recursion, which is more doing drug repurposing, So it's a way of finding a new target, for an old compound, or in sitro, which is doing really interesting things too. But because these have higher biological risk, to us and many others, they may be less interesting. Though these companies are doing and have done very well. Recursion with an IPO in the not too distant past. But then there's that middle section of small molecule discovery against specific targets that are led by structure. Now with the the publication of AlphaFold 2 and all the novel ways that you can look at compound and protein interfaces, this could be a very attractive area for further investment. And so we ask, who are the experts and what are the opportunities for building companies in this space? Genesis Therapeutics with A16Z is doing something here. Exsentia has as well. Relay, I would put into this category based on some of their work with SoftBank, Extalpi. And so I think this is an interesting area. It's met with a lot of skepticism, but we're beginning to see some successes. A third area that you can't avoid, and who would want to, is molecular glue. And there are many different forms of molecular glue and companies in those spaces. The ones that are, I think, the most well established, where potentially the wave has crested, but there's still opportunity, it's just a higher bar, is in heterobifunctional protein degraders, for instance. There's Monte Rosa, Stablix, Frontier, Nurix, Arvinas from the distant past that got a start in this area, and C4 Therapeutics, not too long after that. There are many PROTAC and PROTAC-like companies. The challenge here is that these are typically large molecules with poor developability. So anyone who can crack that developability issue, and some are focused on that, I think will do well. So to skate to where the puck's going to be is going to be to skate to where somebody has solved that developability problem. In the middle are the monovalents. These are much more small molecule, drug-like entities. And there are companies, really new companies in the space. Neomorph here in San Diego, funded by Deerfield, Amphista in the UK, Dunad, which just did a huge deal with Merck. These are folks that have come up with unique ways of identifying and developing small molecule glues that either degrade or do interesting things. And I think that there's a lot of potential here. They're more amenable to traditional drug development, but they're hard to find. There really aren't that many examples of molecular glues out there. The auxins, FK506, rapamycin, et cetera, and so forth. So the next question, and I think the big one, is how do you find these in a systematic way? And that's, I think, going to be very fruitful in the future. We did find one company, came out of David Baker's lab, some brilliant young scientists in their 20s, who came up with A-Alpha Bio, who were working on this space. I suspect that there are going to be more as new, innovative, creative ideas come out. And then the last one that I want to touch on before going into Lycia, and which will be a nice segue into Lycia, is protein degradation. Similarly, protein degradation, as we just talked about with the PROTACs, is a pretty heavily populated space. But they're all really focused on targeting cytosolic proteins. So the question is, what about cell surface proteins and secreted proteins, the other 40% of the proteome? Now, in secreted proteins, there are FcRn inhibitors like efgartigimod, which basically block the recycling of IgGs that are taken up into the cell. But that's a very limited set of molecules. So what are the other opportunities? And so is there a wave of innovation that can happen in the extracellular protein degradation space? And that's a question that we've asked ourselves, and then came in the opportunity to develop this company called Lycia. So Lycia, I'm going to tell you a little bit about how it started in a moment, and then take you through how it mapped onto the criteria that we think are important for a company and just kind of how we got there and some lessons learned at the end. But for those of you who don't know, Lycia is the company we built with Carolyn Bertozzi in the extracellular protein degradation space based on her LYTAC technology. LYTACs are lysosomal targeting chimeras, which are bifunctional molecules whereby one end is an antibody that attaches to your target of interest. And then on the other end is a ligand that can traffic that bound cargo, that target of interest, into cells and into lysosomes for protein degradation. It's a simple, appealing, and elegant concept to tackle, that 40% of the proteome that's inaccessible, to largely to PROTACs. Although some PROTACs do go after the cytosolic tail of cell surface proteins, what about the outside portion? So what I'd like to describe to you now is how Lycia got its start, through our eyes. And so prepare for the journey as to how it relates to all the things I've mentioned so far. And here's the path it took. Obviously, first of all, as Carolyn likes to tell everybody, as a glycochemist, she saw all this stuff happening in the protein degradation space, and she became very jealous of all the people working there in protein degradation and feeling left out, or at least that's how she puts it. But so when she got the technology that I just described to you working in her lab, she actually published it in ChemArchive, which is great. We are constantly looking at ChemArchive and bioRxiv for new ideas. It's a preprint. These are preprint journals. They're not peer reviewed, so you can't be sure that at the end of the day they're going to get published, but at least it's a starting point. And as soon as she put that into ChemArchive, her good friend and the founder, one of the founders of the PROTAC field, Craig Cruz, saw it and tweeted it. Okay, and who would think that Twitter would become a source of new company ideas? Well, it did in this case, and some of our more sophisticated colleagues, not myself, were on Twitter. I quickly got on Twitter because I saw how powerful this could be. Social media generated ideas, and so that came into Versant. One of the partners at Versant saw this and knew we were looking for a new idea, called me on this iPhone. And then suddenly it became a discovery engine project here at Inception, but not immediately. It of course required some diligence and some work. So the first question, as I mentioned before, is the question that we always ask ourselves: is this a differentiated opportunity in a compelling space? There's no doubt that protein degradation is an important space. Look at all the pharma deals. Look at all the companies. This is a new way of going after the undruggable, those exact targets that I mentioned that are genetically or clinically validated to some extent, just waiting for the best molecule to come to pass. So, but it's pretty clear that other than antibodies that can drive target internalization and some receptor cross-linking opportunities, and those few FcRn inhibitor companies that I mentioned, this 40% of the proteome is largely unserved. And so, boom, immediately there's a differentiation. But we're not, and so it's a hot space, a compelling area, but and it registers at least on one level in terms of differentiation and an important wave. The second thing that we always ask ourselves is how much technical and how much biological risk is involved. So for those of you who don't know, the way that the system works, it's really based on, the LYTACs are based on decades of work around well understood biology. And Carolyn is simply leveraging actually millions of years of evolution. The M6 phosphate receptor has existed for eons. And its role is severalfold, but one of them is when proteins get shuttled from the Golgi and they inappropriately get outside of cells, they have been tagged with an M6P, and so this receptor can pull them back in and funnel them into the degradation pathway. But I think more importantly is that it's already a validated technology. This is the way that enzyme replacement is done. Enzyme replacement therapeutics, and where you take a protein, you put an M6 phosphate on it, and then you can deliver it, to cells to replace the deficient enzyme. And so very little biological risk, and seemingly a very little technical risk as well. It's one of those ideas where you're just like, God, why didn't I think of that? It's just staring at you in the face. So low biological risk and ostensibly low technical risk. So the next question you ask is, are there a broad set of applications? We don't want just one. There needs to be many for us to get excited. And also, are these in spaces where big pharma is going to be interested as well? And so we used our network within Versant, as well as people we knew, and we asked, what are your best ideas? Carolyn already had 30, and we added another 30 to that, through our internal diligence. And over time, it winnowed down into 4 kind of broad categories. The first is degrading challenging membrane targets like certain receptor tyrosine kinases. The second is clearing protein aggregates and immune complexes. The third is removing circulating immunoglobulin. And the fourth is you're not restricted only to internalizing through the M6 phosphate receptor. There's also GalNAc that can take things up into liver through ASGPR. There's also folate, which can take through folate receptor things specifically up into tumors. And so I realize that we're running short of time, and I do want to make sure that there's time for Q&A. So I won't belabor the point, but suffice it to say that there are many challenging membrane targets, RTKs, some ion channels. There are also protein aggregates and immune complexes. So when you dig deeper, you start asking yourself, is this the only way of going after these or not? So challenging targets, that's a great space to be in. There are also protein aggregates. If you could take an antibody, LYTAC it, and pull those aggregates, like for instance, beta amyloid or fibrils that are formed in amyloidosis, or deglycosylated IgA and IgA nephropathy. There's no way to go after those pathologies directly today, but with LYTACs there are. Another approach is, instead of LYTACing an antibody, is to LYTAC an antigen and go after those autoantibodies themselves. So if you can take an antigen that causes an autoimmune response, you can basically titrate out the autoantibody with a LYTAC and drag those complexes into cells for degradation. And then lastly, there are ways, as I mentioned, with different internalization receptors like the folate receptor to, in a cell type or a tumor specific way, drag things into cells for degradation. A couple more slides. Of course, we need to show, yes, we've got applications. Yes, some of them are really compelling. Does the science work? Does it translate to anybody else's hands? And that's where inception comes in, and one of the facets of inception. So first we asked, can we get it to work with cell surface receptors? And indeed we can. We were able to recapitulate, the EGFR and the PDL1 work that Carolyn later published in Nature. We also asked, could we pull in soluble proteins? And sure enough, we can do that too. We used IgG2A as a surrogate and showed that in cells and then later in vivo that we're able to pull these complexes into cells and internalize them for future degradation. And so when you look at all the different areas that we need to get excited about a new idea, LYTACs and Lycia registered on each and every front, from being part of a major wave of innovation, being a compelling technology with reduced risk that was differentiated versus all the other degradation technologies. Many opportunities could be reduced to practice, We've got Carolyn Bertozzi, who, if you ever get a chance to do a company with Carolyn, I suggest it. She's super fun, super smart, and has a great way of explaining science to anybody and everybody. And then dual liquidity. And I will mention that when we and it's actually in 2 slides from here. So just to mention, the company has been launched. It's now based in San Francisco, South San Francisco. There are close to 30 people now at the company. It's got a strong IP position in multiple programs in the pipeline. They recently secured a $70 million Series B financing, as well as a significant deal with Lilly. And so Lycia is off to the races, and we need more companies like this. So just really briefly, I want to touch on a couple of lessons learned. Finding new co's. There isn't one good place. You have to look everywhere, even Twitter, and you have to use your network. Versant, Inception, all the people you've ever met. Don't burn any bridges. You may, one of your lab mates next to you or someone on this video may actually be your next company founder. In all seriousness, the platform versus pipeline question always looms. It's really difficult to strike this balance, and you'll always be wrong, but it's just a question of how wrong you're going to be, and hopefully we get it right more and more over time. If you focus on pipeline candidates too early, you will fail unless you're incredibly lucky, because you need to learn about the technical feasibility of the platform. All platforms have their strengths and limitations. Find those out, but find those out on targets that you'd really like to take forward if you're successful. That's the balance. And then lastly, the people are incredibly important. We plan to do more than one company with Carolyn. Her credibility is of the utmost importance. It's important to be science driven and not just taken by hype. And then also in building the company, our first hire was Etna Trombley, who is a scientist by training. And she came out of MIT as a chemist, and then she came up through the business route after that. Ultimately, last role was at NGM as president and COO, and then came on board as the first employee, full-time employee of Lycia. And she did a great job of very carefully, selecting, people to build the right culture and keeping an eye on high science to make sure we had the best people in the company. Because platforms are challenging, and you need really smart people that are dedicated, to put the puck in the proverbial net. So that's where I'll end. I think we've got at least 10 minutes for Q&A. So I'm happy to take any questions.